Hello students, I'm the OGGuru Dr. Punit Bhojani here with a single point agenda to make OBGY your most favorite subject, most scoring subject. Now, very important video coming up. Many students were requesting me that, sir, oncology we find very tough. Oncology, specifically cervical cancer, endometrial cancer, ovarian cancer. So here's me presenting the top 10 oncology MCQs for the upcoming NEET PG 2026. Feel free to get in touch with me on phone and WhatsApp on this number, and happy to announce the live RR starting from 21st of July. There are going to be 10 sessions. I'm going to cover everything. More about this later on, only in 899 rupees, and the recordings will be available till the date of your August exam. Download the OGGuru app and WhatsApp me on this number if you have any doubts. More about this later on. 10 live sessions and OBGY will become your most scoring subject, most favorite subject. Now let us begin the MCQs. So this is all the types of MCQs are there in this video. By all the types, I mean the new pattern, like as you can see over here, match the column, multiple correct, and there are images, very important. Stay right till the very end. In the end of the video, towards that, I'm going to discuss 3 very important images also, which are likely to be coming in this upcoming NEET PG examination. Now, match the column. Now, why I like this match the column kind of question? Because indirectly, they are asking us 5 MCQs. 5 separate MCQs are being asked, because here are the 5 different tumors, and match the column with the following tumor markers. Okay, now epithelial ovarian tumor, all of us know CA125 is the tumor marker, isn't it? So E5. So when you see E5, so automatically 2 options are gone. 2 options are gone. That's how you solve match the column. Okay. Now I'll tell more about this CA125 in some time. Choriocarcinoma beta HCG is the tumor marker for choriocarcinoma. Dysgerminoma LDH. Okay, please comment in the chat box for dysgerminoma. There's one more tumor marker. Dysgerminoma LDH is the tumor marker, but there's one more also for dysgerminoma. So A1, and we already have our answer. Yolk sac tumor, also called as endodermal sinus tumor, alpha fetoprotein B3, C4 granulosa cell tumor, inhibin, and D2, as I already told you, beta HCG for choriocarcinoma, and E5. So very, very important 5-star slide coming up. 5-star slide. Why I call it as 5-star? Because multiple questions can come. As I said, endodermal sinus tumor or yolk sac tumor, alpha fetoprotein, the tumor marker, epithelial tumor, CA125, dysgerminoma, LDH, and one more which I was asking you, alkaline phosphatase can also be in the exam, and granulosa cell tumor, inhibin. Also comment, by the way, this is gynecology, but also comment in obstetrics. In obstetrics, where is inhibin used? Obstetrics, which test we use in obs patient? Pregnant lady, which test we use inhibin? Please comment in the chat box. Now, please understand this. So the answer is our option number A, A1, B3, C4, D2, E5. Option number A is the answer. Okay. Now, very, very important 2 further things. CA125. Is it specific for epithelial ovarian cancer? No, it is not at all specific. It is not non-specific. So please comment in the chat box which gynec conditions CA125 is elevated. It is not specific means many other conditions also other than epithelial ovarian tumor, CA125 can be elevated. Please comment in the chat box 2-3 important conditions in gynecology where CA125 is elevated. Yes, colon cancer, pancreatic cancer, all that is there, and I'm going to give you a trick. What is the trick? Clap if you feel happy. Okay, sir, any abdominal organ you take, any abdominal organ of your choice you take, and agar uske piche I add ITIS, then CA125 will be elevated. Means what am I saying? Pancreas, pancreatitis, gastric, gastritis, hepatitis, colitis, appendix, appendicitis, peritoneum, peritonitis, thokotali, clap, salpingo, salpingitis, fallopian tube, salpingitis. Okay, so any abdominal organ we take plus the inflammation ITIS, there the CA125 is going to be elevated. Pancreatitis, colitis, appendicitis, all this is there. And please, you will also comment which are the other 2-3 very important conditions in gynecology where CA125 is elevated. Okay. Now, one more thing, very famous you get in the pathology, the histopath bodies. Okay, histopath bodies. Okay, this is again a pathology MCQ, but I'm teaching you anybody. For epithelial ovarian tumor, we get Samoma bodies. And please comment in the chat box Dermoid will see a tooth, bone, hair, and the rocky transcript protuberance. Please comment granulosa cell tumor. What is the body seen? Okay, and in endodermal sinus tumor, what is the body seen? Please comment. I'm giving you a clue. Clue ये है कि the second letter. Okay, so granulosa cell tumor का जो body है starts with letter C. Please comment in the chat box. And endodermal sinus tumor का जो body है on histopath starts with letter S. Very important. I'll give you the answer in the chat box. Please comment. So this is the trick. Clap if you feel happy. Okay. So एक CA125 का trick I told you. Multiple conditions which CA125 is elevated, and for histopath bodies, again it's a very famous MCQ. It's of course an MCQ in pathology, and the granulosa cell tumor, the name of the body starts with letter C. Endodermal sinus tumor, here second letter is S, so the letter starts with letter S. Please comment in the chat box. So very important table, and here lots of questions are expected. You can also get a clinical question. They can give you ulta. Let's say this is a condition, this tumor marker is elevated. What is the tumor which the patient is having? Okay, now moving on again. Now see this multiple. Now the problem is when the students get the question, they directly start marking from here. No, please understand this. Till here is the MCQ. Till here is the MCQ. And then your options are starting. So longest question, long stem, and students panic. Okay, nothing to worry. Okay, so please, a 55-year-old lady complains with postmenopausal bleeding. Okay, and was diagnosed with adenocarcinoma of the endometrium. So basically, CA endometrium. CA endometrium is our question, and all of the following are either the risk factors or the predisposing factor for the same. Which of them? Okay, so nulliparous, only estrogen, all that. Okay, so again, clap if you feel happy. I am going to tell you one thing. It is a estrogen dependent tumor. तो कैसे याद रखना है? EE. EE का मतलब है estrogen is going to be the etiology. EE, estrogen etiology. Clap. And PP, progesterone is going to be protective, isn't it? So clap if you feel happy. The trick to be kept in mind is EE. EE matlab sir, estrogen will be the etiology, and PP, progesterone, is going to be protective. Okay, that is the first trick. So please keep in mind that if we give only estrogen, that's why we never give only estrogen. So if unopposed estrogenic action, basically unopposed estrogenic action, unopposed estrogen, and therefore chronic anovulation, nulliparous patients, only estrogen in the HRT, early menarche, late menopause, all these. Okay, again remember the age group. Age group is mainly seen in post-menopausal, 50, 60, 70 years. Okay, so these are all the risk factors. And can you tell me why diabetes and hypertension also is a very important risk factor and predisposing factor? Why? Because what is, clap if you feel happy, virgin MCQ, corpus cancer syndrome. What is corpus cancer syndrome? Anybody? Yes, sir. It's a triad of obesity, hypertension, and diabetes. I repeat, obesity, hypertension, diabetes associated with CA endometrium is called as corpus cancer syndrome. Surely this MCQ is coming in the exam. So therefore, automatically diabetes and hypertension also become the risk factor. Yes, prolonged use of DMPA. DMPA is progesterone, and progesterone, as I told you, is protective. What else could be protective? Yes, our OC pills. Okay, OC pills, LNGIUD, Mirena, POP, DMPA, all are protective. Okay, so OC pills, pregnancy, multiparity, Mirena, POP, all are protective. So basically fourth is protective. So 4 should not come. 4 and 4, this is out, this is out. Only 1 and 3? No, 1, 2, 3, all. 1, 2 and 3 except for 1 and 3 nahi. Only 1 and 3 nahi. 2 is important. Only estrogen, HRT is very important. If you give only estrogen, it is unopposed estrogen. Therefore for HRT we always prefer to give E plus B. Okay. So 1, 2 and 3, and that becomes the answer. 1, 2 and 3, that is it. Okay, if the, of course, uterus has been removed and there is no risk of endometrial cancer, then only on those patients you give only estrogen HRT. Thus for HRT always you give E plus B. Okay, so these are the risk factors. Protective factors I told you, OC pills, POP, Mirena, that is the same. Mirena is same as our LNG intrauterine device, POP, all that are protective for CA endometrium. And do not forget this corpus cancer syndrome. This virgin MCQ surely coming. And one more virgin MCQ, please comment in the chat box. Tough MCQ, Fado MCQ, Simpson's pain. What is this Simpson's pain? And Simpson's pain is seen in which condition? Please comment in the chat box. Okay, Simpson's pain. Simpson's pain. Is it seen in fibroid, endometriosis, cervical cancer, endometrial cancer? Simpson's pain is seen in which condition? Okay. And corpus cancer syndrome, do not forget, very, very important corpus cancer syndrome. It's a triad of obesity, hypertension, diabetes associated with CA endometrium. So moving on to the next MCQ, again a longish clinical questions. Okay, 48-year-old, para 3 living 3, very good, presents to OPD with heavy menstrual bleeding, heavy menstrual HMB, that is menorrhagia, pelvic scan is okay, no pathology, office endometrial biopsy or aspiration is done. Why? Always keep this rule in mind. Okay, sir, whenever I have got a perimenopausal patient, histopathological examination of the endometrium is mandatory. Can you tell me why? Why mandatory? Why compulsory I should do histopath? Yes, because sir, any patient who is postmenopausal, I have to rule out. Okay, we need to rule out endometrial hyperplasia and endometrial cancer first. Is this understood? Before proceeding for the actual management. Which age group? Perimenopausal. Okay, so any patient who is perimenopausal with heavy menstrual bleeding or even postmenopausal with bleeding, histopath examination is compulsory, mandatory. Please keep this in mind. And this was done. Office endometrial aspiration, that means same thing. Endometrial biopsy shows endometrial hyperplasia but with atypia. Oh my god, atypia. So what is the most appropriate management? And moment the student sees atypia, directly Wertheim's hysterectomy. Yes, one of the most favorite word, Wertheim's hysterectomy. Wrong, clean, bold. Okay, students only know anything in cancer. Wertheim's hysterectomy. Wertheim's hysterectomy is another name for modified radical hysterectomy. And that is not the answer over here. Why? Because please understand this, that so students will, whenever atypia आ गया, so directly Wertheim's hysterectomy. बोलने को बहुत अच्छा लगता है, but please understand, Wertheim's hysterectomy or modified radical hysterectomy is for actual cancer. This is not cancer. This is endometrial hyperplasia with atypia. So please understand this, and specifically in a perimenopausal patient and family is complete. Okay. Obviously, estrogen is a risk factor. We don't give estrogen. Estrogen will cause hyperplasia and cancer more. Okay. And similarly, in a perimenopause, we avoid giving OC pills also. So what is the take home message? Yes, the take home message is that yes, sir, simple hyperplasia. I'll tell you the numbers also. Simple hyperplasia or complex hyperplasia is given the question with atypia when they say, even if atypia is present, whether atypia is there or not, if it's a perimenopausal woman, please understand this, simple hysterectomy is more than enough. What is the meaning of simple hysterectomy? Sir, simple hysterectomy is not simple to perform. Okay, simple hysterectomy means, my dear student, whatever, again the route is not important. I can do it abdominal, vaginal, laparoscopic, whichever route I operate, only the uterus and the cervix comes out. That means there's no need to remove the parametrium, lymph nodes, tubes, ovary, all that I don't have to remove. So simple hysterectomy is the one which I basically do for any other benign condition. Okay, so what hysterectomy I will do with atypia? Yes, even if atypia is present, the hysterectomy is like any other benign condition. Is this understood? Clap if you have learned something new. So sir, even if atypia is present, it is not yet cancer, it can become into cancer, and therefore only a simple hysterectomy which I do for any other benign condition like a fibroid or a prolapse or a menorrhagia is more than enough. So two important rules: perimenopausal histopath has to be done, your histopath was done, and endometrial hyperplasia with atypia hai, so simple hysterectomy is more than enough, and Wertheim's hysterectomy not required to be done. It's like a overkill. Okay, if you have a fly मक्खी को मारने के लिए don't shoot a gun or a rifle. Okay, so don't do over surgery, don't do overkill. Okay, so Verdam's hysterectomy, you don't require a modified radical hysterectomy or Verdam's in this case, which is only hyperplasia. Okay, also please comment if it's a young patient, what do I do if it's a young patient? So again, a 5-star slide, please by heart this numbers 1, 3, 8, 29. रात को नींद में से भी उठ के भी पूछा, in the middle of the night if somebody wakes you up, you should know this numbers 1, 3, 8, 29. Even if you remember 30 for me is okay. 1, 3, 8, 30. So simple hyperplasia 1% chance of cancer, complex hyperplasia 3%. The simple and complex is under the microscope. Okay, please understand this. Hyperplasia is my histopath diagnosis, histopathological examination of the endometrium, and simple with atypia, which was this case 8%. And even if it's complex with atypia, maximum 30% chance of progression to cancer. But it is not yet cancer. It can become cancer. So please understand this. Even in this case, if simple word is replaced by complex. Okay, if it's a what? If it's a complex hyperplasia also with atypia, no problem. Answer is still simple hysterectomy. Verdam's hysterectomy or modified radical hysterectomy is not required because this is a pre-malignant condition. It can become cancer, but it is not yet cancer. And if the hysterectomy is like any other benign condition, what we call it as a simple hysterectomy, where only the uterus and the cervix comes out. Is this understood? So again, a very important table. Please by heart, these numbers are important. 1, 3, 8, 30. It could be asked to you, or just keep in mind this concept. Moving on to the next very important. Again, a 55-year-old lady, outpatient department, postmenopausal bleeding for 3 months, and when I do a per speculum examination, 1 into 1 centimeter nodule on the lip of the cervix. What is the most appropriate investigation to be done? Now directly student, anything to do with cervix, they will say pap smear, and again wrong. Why wrong? Because please understand this, pap smear is a screening test and this pap smear time is gone. So when I have a routine patient, please comment in the chat box, please comment in the chat box, the pap smear is to be done for what age group? What is the age group which I do the pap smear test? Pap smear test should have been done for this lady many years ago. Okay, now here please understand this. So routine patient comes to the OPD, of course I do a pap smear as a screening test. Also please comment what is the best. If cost is not a problem, please comment what is the best screening test, what is best available, something new today with pap. I'll show you about this also later on, the image based question also I'm going to show you. Okay, so stay right till the very end. So pap smear first age group, you tell me why sir pap smear is not the answer? Because sir pap smear is a routine screening test. We do it when the cervix is normal looking and we do a pap smear test. Here please understand this. And why I don't do colposcopy? Sir, when the pap smear is abnormal, okay, when the pap smear is abnormal, if the pap smear shows dysplasia or pap smear is abnormal, then I perform a cervical biopsy, and that is preferably colposcopic guided, colposcopy plus biopsy. Colposcopy is just an instrument. It gives us magnification. We can apply the acetic acid, and with aceto white area, whichever we see, we can go and do a cervical biopsy. So if the MCQ is, okay, a patient has come to the OPD and the pap smear is showing abnormality, then I will do a cervical biopsy, colposcopic guided. Okay, colposcopy just gives you an idea. So colposcopic guided cervical biopsy can be done. But here please understand what is the scenario. Sir, here the scenario is that we are seeing a 1 by 1 centimeter on the anterior lip. We are seeing a nodular growth. Or in another MCQ, they can give you a fungating cauliflower-like growth. Okay, both same, fungating growth. Any growth on the, so they can tell there is a fungating cauliflower-like growth. Okay, or a nodular growth as it is over here. So whenever it is a growth which I can see the growth, I will directly want to take a piece of it, which is called as punch biopsy. Is this understood to all of you? Please comment. Therapeutic cone biopsy is for which condition? Therapeutic is to treat. So therapeutic cone biopsy I do for which condition? Please comment in the chat box. So colposcopy is to be done when the pap is abnormal. Pap smear is a screening test. It's not important. It's not possible. It's not to be done over here because directly I am seeing a fungating growth. Is it clear? Because obviously, sir, when I can see the growth, I will take a piece of this growth. Is it clear? And that is called as a punch biopsy. So whatever it is, you take a piece of it, which is called as a punch biopsy. You take a punch of it. Okay. So colposcopy is done only when the pap is abnormal. Colposcopy gives you magnification. What filter to use in colposcopy? All that coming up. Picture abhi baki hai mere dost. Okay. Is it understood, all of you? So I repeat the flow chart that, sir, when the pap smear is abnormal, we do a cervical biopsy, preferably colposcopic guided. That is one MCQ. And when I see a obvious fungating growth or a nodular growth given on the lips of the cervix, then I do a punch biopsy. You take a piece of that growth. Is this understood to all of you? So punch biopsy is the answer to this very important MCQ. Don't make a mistake. Therapeutic cone biopsy, please comment in the chat box. It is used as a therapy. It is used as a treatment for which stage of cervical cancer? Which early stage of cervical cancer we can just get away by doing a therapeutic cone biopsy, specifically in the young patient. Okay. So pap smear is a screening test. Please comment what is the age group for the pap smear and what is the best screening test, what is the best screening test available today, and that is something more. Pap, I'll tell you about it. Pap and LBC and something more we do, and what's the name of that test. Okay, so pap abnormal, colposcopic guided cervical biopsy, obvious fungating growth, nodular growth, whatever growth if you are seeing nodular growth, we go and do a punch biopsy. Is this understood? Yes. Now see this. So as I told you, pap smear, a 30-year-old nulliparous patient came, pap smear was showing abnormality. So what do? Yes, sir, colposcopy and biopsy. And now it is CIN-III. What is the next line of management? Okay. Now again, when I say students say CIN, a lot of confusion. Is CIN cancer? What is CIN-III? So please don't confuse. CIN-III and CA cervix stage 3, same or different? Anybody? CIN-III, CA cervix stage 3, same, right? Same or different? Completely different. So please don't make a mistake. This is not, CIN-III is not, it looks very basic, but in the heat of the exam, students have made a mistake. Okay, oh sir, MCQ was cervical cancer stage 3, I thought CIN-III. Or CIN-III tha, I thought CA cervix stage 3. Okay, because so many years of teaching, I know where students make a mistake. So CIN-III is not CA cervix stage 3. Is this understood to all of you? It is not. Both are different. What is the difference also I will tell you in some time. And what do? So if in a nulliparous patient and in a 30-year-old, if I remove the uterus, I have to go to jail. Jail matlab it's a big crime. You're not required. Again, it's not required to be done over here. Is it clear to all of you? So you don't do it. Please don't do it. Jail matlab it's a big crime. Okay, is it clear to all of you? Now, CIN-1 and 2, repeat pap smear and colposcopy can be done if it was only CIN-1 or CIN-2. Because CIN-1 and 2, we can just do a follow. But here it is CIN-III. Now, please understand this. First of all, we should also know what is the meaning of CIN. So, in CIN, please understand this. Again, the CIN is the diagnosis under the microscope. So, in all of them, the basement membrane is intact. Yes, answer CIN-1, lower 1/3 cells are filled with abnormal cells. This is again the pathology. CIN-2, lower 2/3 cells are abnormal or filled with abnormal cell. CIN-3, they say almost the entire thickness filled with abnormal cell. And carcinoma in situ, the whole thickness is filled with abnormal cell. Is understood? So this again, my dear student, is your histopath diagnosis. By looking at the patient in the OPD per speculum, don't comment, so this is CIN-1, 2, 3. Is it clear? On per speculum, I cannot make the diagnosis. This is histopath. Pathologist will tell you. Now, please understand this, the basement membrane is intact. Only if the basement membrane ruptures, then there is cancer. So, just a progression which all of you should know. I know all of you know, but just to tell you, okay, why this is not difference, please understand this. Okay, sir, first the patient may develop CIN-1, then she might develop CIN-2, then it will progress to CIN-3, then carcinoma in situ. Till here, the basement membrane is intact. and when the basement membrane is ruptured, then you get, yes, then the cervical cancer starts, and then it will be stage 1, stage 2, stage 3, stage 4 of cervical cancer. Is this understood to all of you? So do not make a mistake. This is simple, but in the heat of pressure, exam ka pressure and tension, okay sir, basement membrane is intact in CIN. So ये just आपको बताने के लिए कि sir CIN-III and CA cervix stage 3 both are different. Even the management is complete. They are poles apart. Different दिख रहा है, ये एक side पे, एक side पे. So here the basement membrane is intact in CI. तो अभी तक आंसर नहीं मिला. तो now क्या करना है? Sir, whenever I am giving you a mantra, कि sir, whenever I have a patient who is CIN-III and is specifically a young patient, she wants to preserve the uterus for further childbearing, then there is no need to remove the uterus. Hysterectomy is not required. Okay, I told you don't repeat PAP and this also. So two options are out. What do we do? Yes sir, we do a procedure called as LEEP or LEEDS, loop electroexcision procedure, LEEP. I repeat the full form, loop electro. There is a loop. Okay, there is a loop and you pass a current in that loop. There is a loop like this. Okay, it's a loop like this, and with this loop you pass current and you loop electroexcision procedure, also called as large loop excision of the transformation zone. So we can declare the patient cure and then you can say कि go and have your babies. जा जाके जी ले अपने, जा सिमरन जा. Okay, अमरीश पुरी काजोल रेलवे स्टेशन DDL जा सिमरन जा, जा जाके जी ले अपनी जिंदगी, मतलब go and have your babies. So in a 30-year-old patient, the answer is LEEP or LEEDS. Why I do LEEP or LEEDS? Large loop excision of the transformation zone, and patient is declared cure, uterus is preserved, and she can have her own babies in the future. So CIN-III, it's a young patient, LEEP or LEEDS. Both mean the same thing. LEEP, LEEDS mean the same thing. Loop electroexcision procedure or large loop excision of the transformation zone is the treatment. Please keep this in mind. It is not CA cervix stage 3. Please comment for cervical cancer stage 3. What is the treatment? Cervical cancer stage 3 अगर MCQ है, what is the treatment? Please comment in the chat box. Is it clear to all of you? Yes. Moving on to the next MCQ. So young patient CIN-III, LEEP or LEEDS is the answer to preserve the uterus. Is it understood? Because it is not yet cancer. It can become into cancer. Again, it is not cancer. It's a pre-malignant condition. It can progress to cancer, but it is not yet cancer. And therefore I can preserve the uterus. Is this understood to all of you? Yes. Moving on to the next very important MCQ. This is very, very important MCQ. Now again, the mistake which students make is what? They don't read the question. A routine PAP patient comes to the OPD, routine cervical screening, and PAP smear shows abnormal cells, atypical cells. What do I do? Cervical biopsy. Yes sir. Just now only you told me, right? Just now I told you. Okay sir, when the PAP smear is abnormal, when the PAP smear is showing dysplasia, any abnormality, we do a cervical biopsy. Yes, that is true. But here, please understand one word. One word changed the whole MCQ. Okay, yes, sir, we are seeing atypical cells, but we are seeing atypical glandular cells. Now, glands kahan se aata hai? Yes, sir, cervix is to squamous cell cancer, isn't it? The CA cervix, the cervical cancer mainly we know is squamous cell cancer, and yes, as I told you this already, if the PAP is showing abnormality or dysplasia, we do colposcopic guided cervical biopsy. So PAP is abnormal, but please understand this, that in this PAP smear, it is atypical glandular cells. So please understand this, that the PAP smear test, if only it was PAP smear shows a typical squamous cell or something, then the answer would have been cervical biopsy and colposcopy. Okay, if it is showing atypical squamous cells or whatever. Okay, but here please understand this kya hai difference, my dear student, is that it is atypical glandular cells. So PAP smear, by the way, please understand, PAP smear is a screening test for cervical cancer. But if the patient has CA endometrium, in case if the patient has a CA endometrium, of course, histopath confirmatory, and this PAP smear is only your cytology. PAP smear, remember, is cytology. Okay, remember that. PAP smear is cytology, atypical cells we are seeing. Okay, so by chance, if a patient has CA endometrium, those endometrium cells can get exfoliated and can come in the posterior fornix or in the cervical area, and when we do the pap smear test, it can pick up this. So it's an incidental finding. It's an incidental finding that the pap smear is showing atypical glandular cell. It's not supposed to show. So sir, ये atypical glandular cells कहाँ से आ रहा है? Glands, yes, adenocarcinoma, CA endometrium. So I have to, when I have this atypical glandular cells, I have to think of CA endometrium. Are you getting my point? Endometrial cancer is what I'm supposed to think out, and I need to rule out endometrium cancer. Is this understood to all of you? Rule out CA endometrium. Okay. CA endometrium I need to rule out, and therefore I will not only do cervical biopsy because it is atypical pap, I will also do endometrial biopsy. Do not directly jump to hysterectomy. Is it clear? Is it clear? So I repeat, cervical biopsy and colposcopy would have been the answer if only pap is showing, they tell you pap is showing dysplasia or pap is showing abnormality or pap is showing dysplastic cells, dysplasia or abnormal cervical cells, okay, cervical cells. But here because glandular cell has come, glandular word matlab glands is CA endometrium, I need to rule out CA endometrium also in this patient, and therefore I will do, yes, cervical biopsy, one more step, endometrial biopsy, combination. So what is the advantage of this option C? That sir, with one investigation, endocervical and endometrial biopsy, with one investigation, I will be able to rule out or find out. I will be able to find out whether patient has got cervical cancer also and CA endometrium also. Both the things with one shot. Because sir, cervical biopsy le liya. If the patient has cervical cancer, this will be detected. Early stages, whatever, CIN-I, 2, 3, whatever. And if the patient has CA endometrium, then this also we can find out. Is this clear with this endometrial biopsy? So here are the answers. So I repeat, if only the pap is showing abnormal atypical squamous cell or atypical cells or pre-malignant cells, then it is only restricted to cervix. Then the answer is colposcopy cervical biopsy. But here, since specifically atypical glandular cells are seen, I have to rule out endometrial का endometrial hyperplasia भी हो सकता है, rule out CA endometrium या endometrial hyperplasia. I told you it could be hyperplasia with atypia also हो सकता है. Okay. So rule out endometrial hyperplasia and endometrial cancer. That is possible only by doing endometrial biopsy, and therefore option C is the answer. Clap if you have learned the new concept. Okay, moving on. Again, a very, very important tandem and ovoid. Now, when this question comes, student clean bold. पता ही नहीं है क्या है ये tandem, क्या है ये ovoid, पता ही नहीं है. So what is this? Please understand this. Tandem and ovoid radiotherapy. Now, all of you know radiotherapy, sir, is of two types. Radiotherapy, sir, is either teletherapy from external beam from far when I shoot the radiation, that is teletherapy, and one is brachytherapy. Brachytherapy is going close to the organ and giving it radiation. So this tandem and ovoid radiotherapy is a part of brachytherapy we use for cervical cancer. Late stages. It is stage 4 cervical cancer when it is there. What is this tandem? So please understand this. It is a rod. Okay. So this is the uterus. This is the cervix. Okay. So what is tandem? Tandem is a rod. Okay. Tandem is a rod. And ovoid is like two ball-like structure. Okay. So tandem is a rod. Tandem is a rod and ovoid are two ball-like structure. It looks like this. Okay. So what is done is this tandem rod is inserted into the uterus. Okay, through the cervix, and of course the ovoids will remain here like this, and then it will be charged with radioisotopes. This tandem and ovoids are charged with radioisotopes, and then they will give radiation to this cervical cancer stage 3, stage 4. Is it clear? Advanced stage of cervical cancer where we use radiotherapy or CTRT, concurrent chemoradiation. Okay, cisplatin can also be given, and therefore we use the word CTRT, concurrent chemoradiation. So tandem and ovoid radiotherapy is for cervical cancer. It's not for ovarian and endometrial cancer. And choriocarcinoma we completely treat with your medical management, extremely chemosensitive. Endometrium cancer, after surgery we give radiation. Ovarian cancer, we have to mainly give chemotherapy. Okay, so cervical cancer mein, I repeat, we use brachytherapy, and by that brachytherapy, it is tandem and ovoid. Tandem is a rod, ovoid is, this is your tandem, and this is ovoid. Ovoids. Okay, so tandem radiotherapy pucha, tandem and ovoid pucha is for cervical cancer. When the patient has cervical cancer as a part of brachytherapy, please tell me the advantage. What's the advantage of brachytherapy? Okay, what's the advantage of brachytherapy? Please tell me. It was also asked in the recent FMG examination. Brachytherapy, why we give brachytherapy? What is the advantage of giving brachytherapy? Okay, so when we give brachyradiotherapy to a patient of cervical cancer, there we use tandem and ovoid. Very, very important MCQ. And again, remember, image-based questions baki hai. Please understand this picture bhi baki hai. But very quickly, please understand this 10 live sessions, whichever source you have studied OBGY from. As you know, my dear student, 20 to 25 MCQs, 20 to 22 MCQs are going to come in OBGY, and it will become your most scoring subject, life-changing, only in 899. We are going to give you 10 live sessions, including the video-based question also will be there. And I am going to take IBQs, images like this clinical case. Everything will be done. PYQs of not only INI-CET, NEET PG, INI-CET, everything will be covered. Live doubt solving, and a notes read along session also. So download the OGGuru app, and I'll be seeing you live on 21st July, and recordings will be available. And all of you can see all these topics are there. So 899 rupees, 11 sessions, recordings will be available till August exam. My guarantee, OBGY will become your most favorite subject, most scoring subject. Look at the list. All this, 100%. I've been conducting this session since last so many years, and we have got 100% strike rate. When you will walk out of the NEET PG exam, you will message me and call me on this number that, sir, among all 19 subjects, my best performance is in OBGY. Ye hoga, likh ke le lo. Okay, and if your current score is 10, 11, 12, 13 MCQs, just attend these 10 sessions. If you cannot attend live, recordings will be available till August exam. Don't worry. Okay, just attend these 10 sessions, and score in OBGY from 10, 11, 12 will jump up to 18, 19, 20. 6 to 7 MCQs more. 28 marks is the difference between rank of 400 and 40,000, my dear student. So all the topics, infertility, HSG, histolaparoscopy, you can go this, amenorrhea, contraception, fibroid, prolapse, oncology, urogynecology, everything we are going to cover. Trisomy 21, very important. Drugs, labor, malpresentation, PPH, all the recent advances, preeclampsia, eclampsia, all these topics, ectopic, everything, and a video-based abortion. So all these are the list of most important topics which are going to come in the NEET PG, and therefore there are 10 sessions starting from 21st of July only in 899. So many of you have already enrolled. Do not miss out on this opportunity, and I'm going to see you live on 21st. Is this understood? Now, moving ahead. IBQ, image-based question, very, very important. But whenever an image is asked to you, also try to look at the history. What is there? 60-year-old patient. So post-menopause. Again, a obese patient. For a postmenopausal bleeding, she underwent a hysterectomy. Okay, you can see uterus, tube, ovary, all that removed. And the cut section is shown to you. Pathology, yes. So see, fibroids don't present with postmenopausal bleeding. Again, adenomyosis don't present with a postmenopausal bleeding. Once menopause aa gaya, they start shrinking, the fibroids and all that. Adenomyosis cured. Okay, and endometriosis, so everything is outside the uterus. Chocolate cyst, and all that you see. Okay, yes. If you closely observe the cut section, yes, sir, we are seeing a fungating growth in the cavity, which is CA endometrium. Okay, and remember, just one more MCQ, adenocarcinoma is the most common variety. So this is a very important PYQ. Likely to be repeated. Okay, sir, and again I told you, yes, obesity, hypertension, diabetes are risk factors for CA endometrium. That history could be given to you. Postmenopausal bleeding is the most common presenting feature. But remember, postmenopausal bleeding can happen in cervical cancer also. So if the same MCQ is there, or the same image, and if here nothing but here if you see a fungating growth, it is your cervical cancer. Okay, because early stage cervical cancer also we do this hysterectomy. Okay, modified radical of Wertheim's 1A to 1B 2A. Okay, so see the image, because postmenopausal bleeding can happen in both. Postmenopausal bleeding, my dear student, can happen in CA cervix also and CA endometrium also. Both can present with postmenopausal bleeding. Okay, so look at the picture. Where is the growth shown to us? Yes sir, in this picture we can clearly see a fungating growth is filling up the is the endometrial cavity. It's in the cavity, so it is, of course, options may be here. So it is endometrial cancer. Fibroids and adenomyosis will not trouble a postmenopausal lady. They are problem in 35, 40, 45 plus. Okay, is it clear to all of you? And again, for this, if at all you require, you do a simple hysterectomy for fibroids and this. Okay, endometrial cancer, adenocarcinoma hai, fungating growth in the cavity. Next, very very important IBQ. Ye kya hai? Yes, again two things are told to you, asked to you, can be asked. What is this? Yes sir, this is a air spatula. This is a air spatula. Okay, two things. This part is rotated onto the cervix. This part goes in the posterior fornix, and then you prepare a glass slide, and that is your conventional pap smear. Okay, conventional pap smear test ke liye this air spatula is used. Clear? But what is there on the right side? Yes, so this is called as cytobrush, या बड़ा है तो cytobroom. Both means very similar. Cytobroom बोलते हैं या cytobrush. Cytobrush is thoda sa narrow, thoda sa thinned out, and it has got a brush like this. Cytobroom to be precise. And this is what? This is a liquid media. So what is this? So this is a liquid based cytology. What is the advantage of liquid based cytology? One, we get a clear picture. All of you look on the board. So what is done is this brush. This brush is rotated onto the cervix, and then I break the tip of the brush. So brush is first rotated on the cervix, then I dip it in the liquid. Dip, 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 dip. You dip it in the liquid, and then this brush ka part is detachable. This part is detached and put in this media and sent for testing. So liquid based cytology is a newer thing because we get more clear picture. Okay, so normal pap can be a normal pap smear like a dirty picture. Okay, dirty picture under the microscope. He's just away. Okay, so dirty picture, movie had come. Okay, and conventional pap ke badle, when I do a liquid based cytology, we get a clean picture. Why clean picture? Because a very thin layer, thin prep. This liquid is then spun. All the debris, mucus, everything is removed. Okay, so all the debris, blood, mucus, all could be removed, and we get a clean background. Okay, we get a clean background. So this is, of course, your pathology teacher will tell you the advantages. Okay, when I do LBC, so I can pick up more cases. So under the histopath, pap can look crowded and dirty and can be obscured by blood and mucus, and LBC gives you a clean picture, clean background, monolayering of cells. I can pick up more cases, specificity, sensitivity improves. So both the things are shown to you. This image could be shown to you as spatula for doing conventional pap, where you put it on the glass slide and then you smear it. And this is liquid based cytology. Of course, again, you will prepare a slide and see it in the microscope. And this is the cytobroom and LBC ka medium, and this is a liquid based cytology. And please tell me, what is one more advantage of LBC? LBC ka another advantage is, yes sir, I can do HPV testing. So when I want to do HPV testing and HPV typing, what is it also called as when I combine with the pap smear test? Please comment in the chat box. But remember this, my dear student, कि if I have to do HPV testing and typing, testing matlab sir it is positive or negative, and typing means I can tell the patient कि you are infected with this virus 16, 18, which number 6, 11, then I have to compulsory do liquid based cytology. So with a liquid based cytology, only with a liquid based cytology can I comment on, or can I do the testing for HPV testing and typing. So if the HPV testing has to be done, my dear student, testing and typing, I have to do a LBC. Conventional pap smear will not help me. Okay, is this understood? And again, a very very important virgin MCQ. What is virgin MCQ? Those who have heard my lecture, never asked till now, will come in the future exams. Brand new MCQ, virgin MCQ. So ये क्या है? Sir, we can see something. Can you see? Just so when the picture comes in front of you. Okay, so ध्यान में रखो क्या है? Yes sir, this I can see a cervix. So this is the anterior lip of the cervix. This is the posterior lip. Okay, this is the cervical opening. I can see a cuscose. speculum, and we are seeing cervix. So this is not a pap smear being done. Pap smear means spatula. This is not a liquid based cytology which is being done. Okay, hysteroscopy is for what, sir? Hysteroscopy, we go inside and we look at the cavity of the uterus. Now my dear student, please look over here and please tell me, how is the cervix looking like? What is the color? कलर कौन सा दिख रहा है? Yes sir, the whole picture is looking green in color. Isn't it green? So ये क्या है sir? This is the cervix of she Hulk या lady Hulk, isn't it? ये she Hulk का cervix है, lady Hulk, isn't it? Lady sir, ये किस सर ने, which cervix सर ने Hulk lady she Hulk का cervix दिखाया? या who was that? A green color lady in Avengers, green color lady. Please comment in the chat box. Thanos की daughter. Who was that green color lady? Gamora. Yes, Gamora cervix. Is it the cervix of Gamora or She-Hulk? Yes, that's the diagnosis. So this is the cervix. This is the cervix shown of Lady Hulk. Yeah, She-Hulk. She-Hulk cervix shown. Yeah, Gamora cervix shirt. No, okay, that's not it. Okay, so please understand this. Yes sir, the whole picture is green in color and this is a green filter. What is this filter business? Again, this green filter word has come, but this image is virgin IBQ, and this is with colposcopy. Sir, in colposcopy, please understand this, as I told you, colposcopy gives you magnification, and in colposcopy we can apply acetic acid and take the biopsy from the acetobacteria. It's initially a yellow light. And what is this green filter, sir? It's just a green light. So with colposcopy, when I use this green filter, anybody, what is the purpose of this? It's a physics. So this is a whole picture, just a green light. So you're seeing the cervix with the green light, which is called as green filter in colposcopy, which is the answer. Okay. What is the advantage of green filter is the physics principle is there. It's with green color light, the RBCs are seen better. And what is the purpose of seeing RBCs? Yes sir, the blood vessels. Okay, blood vessels, because sir, for any cancer, if it is neovascularization is a part of, can be seen in the pre-malignant and the malignant cells, and which can be very well picked up if I use green filter. So the green filter is to see the blood vessels which show us a punctate pattern, and basically the concept is neovascularization can be detected very well with your green filter. So whenever they ask you, again a virgin MCQ, okay, with colpos, they can give you 4 colors: red, blue, green, orange, yellow. ऐसा color देंगे. Your options will be 4 color. Student will be confused, what is this? So they'll tell you, with colposcopy to detect blood vessels, what color is used, what color light is used, or what color filter is used, blue, green, red, yellow. Answer is green filter. Okay, you can see the whole picture is green in color. Is this understood to all of you? So green filter, colposcopy, very important to see the blood vessel. Here it's looking normal. If there would have been some neovascularization, you will see a punctate pattern and the blood vessels would be seen. So this is a cervix which I can see the anterior lip, posterior lip. So you can identify. I repeat, hysteroscopy is for the cavity of the uterus. So this is not a cervix of a she-Hulk or a lady Hulk, but this is green filter colposcopy. And my dear students, so many lovely messages at the end of every exam, and continuously I keep on getting it. Sir, all questions asked for your notes and lectures. Nothing more extra required to be. All high. All questions, all India rank, so much high rank sir. Every go sir, the all India rank 16,000. All the questions in NEET PG from your videos and notes sir. Every question. OBGY became a cakewalk. Okay, all India rank 400, again OBGY cakewalk. Okay, all questions directly from sir MCQ video. Same thing will happen with you. I could answer even the same format exactly. I could answer every question. Okay, all questions correct in OBGY. Same thing will happen with you, my dear student. And you can see this beautiful handwritten notes. Every student has told me completely colored. Don't worry, you're not changing your source. Whichever source OBGY you have studied from, just attend this 10 classes and you will be able to revise the entire notes in 2 hours is my guarantee. We're going to read the notes along with you also. This is the notes read along session also. So enroll, do not miss out this opportunity. As I said, OBGY is the single most important subject. 20 to 22 MCQs coming in it, and just in 899 download the OGGuru app. Live RR will be there. It's going to be MCQ based RR. Please understand, it's going to be MCQ, question answer, question answer. If this 45-minute sessions helped you, imagine 15-hour session. Okay, 10 sessions are there, 90 minutes each. Whole day study other subjects. Whole day study your medicine, patho, micro, pharma. Evening time, come live, attend 90 minutes with me. This is going to be MCQ based RR, exactly like this video where we discuss MCQs, PYQs, IBQs, and of course video based question, and live doubt solving is there, and only in 899 For the students already, those who have joined our package in the past, they are getting only in 349, just a platform fee we're charging. Okay, so that is me signing off. Bye, best of luck. Thank you very much. See you live on 21st July. Please follow us on Insta. Lots of important content come out on Insta also. Please subscribe to this YouTube channel. Share this video with all your friends. Hype ka button aata hai, hype option. Please hype the video, and the PDF of this will be available on Telegram. So please subscribe to the YouTube channel. Share this video with all your friends and colleagues. And of course, I'm available on phone and WhatsApp on this number. See you live on 21st July evening time. You're going to love it. 10 sessions. Leave the entire OBGY to me. OBGY will become your most favorite subject, most scoring subject is my guarantee. Bye-bye. Best of luck. Thank you very much.